Good morning, ladies and gentlemen. Thank you for being with us today. This morning I will take you through hopefully short and sweet slides and subjects discussing matters around the financial transformation that is happening on the healthcare sector and particularly in Saudi Arabia. Now the first question that we might ask ourselves before we start this, since we're talking about transformation and in particularly the financial and how does that impact the healthcare sector all over the world, is probably wondering around the concept of transformation. Now, there were recent studies around the transformational journeys around the world and how positive impact that has happened through those journeys on the enterprises and businesses. Now, probably there are different areas that the people and the key decision makers and the board of directors focuses on those journeys. But can we ask ourselves, why would transformations fail at any kind of sector, financial or non-financial? Any guess what might make that journey failing? That's a good one. Excellent. Excellent. This is another good point. Now, the recent studies that was made by someone back in Europe and the States around a big event that hosted a huge number of chief executive officers, and they have interviewed them to look at their thoughts and opinions around whether they have made that journey in their enterprises, and it says yes, we did, and how do they feel about the outcomes and objectives that has been met. And surprisingly, 75% around those journeys probably meet partially or completely do not meet the objectives that was intended to be done for them. One key reasons, beside what you have gentlemen and ladies just added, that leaders focus too much on changing the whole regime around the process and technology, but they don't put much efforts around the people. So if you change the policies and procedures around and the processes around any kind of activity in your enterprises, but you don't focus much on the change management and who should receive. I mean, the people working in the companies are the recipients of this change. So you want to transfer them from one state to another, and people in general are reluctant to change because it could put them in a discomfort zone. So one good lesson that need to be, and I have seen it in several times in one of those journeys, that we should focus on people. People are making that change happening on the execution. That we have to focus. So instead of making those people recipients of this change, they have to be partner on us and to changing us from one state to another to evolve the thing. Now, this is what I have been looking at, that most companies has done that, but most of them has probably did not meet the whole objectives that they was intended for. Now, this takes us to, I'll have those presentation top-down approach where I can get you from the national vision of the country, and then we will zoom down into more of a national and then to the facility level of this kind of transformation that has happened. Now, this is coming out of the country's national future ambitious 2030 vision that has launched several programs around the whole activity. And His Majesty, Custodian of the Holy Mosque, King Salman, has mentioned that his first objective for our country is to be pioneering and excelling and successful in the global model in front, and he will work with us to achieve it. Now, as you can see on this, there are several programs, and if you look at the healthcare, it has three key objectives, targets in the long term, and they focuses more into improving the healthcare services and to promote the healthy lifestyle, and also things around the traffic, because accidents really causes a high rate of fatality into this healthcare system, and that's causing a lot of issues and cost prospective efficiency spending. And beside that, there are other key factors to move on into this vision. So that vision, if you can see to the far right, is properly aligned with the country level vision into the sector, into the Ministry of Health, and down to the cluster level. So the transformation journey for this event is focusing into three fundamental areas. The first one is to separate the regulator, which is the Ministry of Health, then the provider. So the regulator, the ministry, will focus into more regulatory steering committee roles. Then we will separate the providers to focus onto that delivery. And then there is a funding arm that can compensate for the services delivered to the patients, but instead of fees for services more into outcomes-based, value-based healthcare. So we're running around 300,000 staff, including doctors, nurses, employees, everybody at the country level, with a spending of 75 billion to 85 billion, around that, and running a huge number of hospitals and thousands of primary health care centers. The key patient outcomes for each of those design principles is to move into more patient-centric, patient-focused, integrated care unit or accountable care organizations, patient well-being through the focusing on the prevention, not only to start the service when the patient comes, but I think we have to go before that and educate people in the mall, in the schools, everywhere on their wellness as a prevention, and also to put more in control on their health and information treatment. So let's zoom in into more of this program. This program focuses into several key programs to move into the new model of care, but also to corporatize the entity. In order to reach that level, we need to work on a more of a corporatized manner. We need to think of how to run the show like companies and like corporates, and then strengthen the accountability, the oversight, so that we can have that results change. So the key pillar is, to do that, we need to have that infrastructure ready. Things like establishing the e-health, all the PACs and networks and health information system needs to be set up properly, preparing the workforce to partner with the private sector, and also to have that sector governance that can impact those things. So focusing more into corporatization is where we are going to separate the facilities and the hospitals from the ministry, and leave the ministry focusing more into the regulatory roles. But still, those hospitals and providers will be owned by the government, but they have their own boards, they have their own management team that can move and achieve their goals and visions. Also, and this is to introduce more onto the healthcare services, and there are a business model that was set for that, where we can create a health holding company that can host the assets and manage that transformation, as we will see in details. So, before we transformed, that was the situation. We had Ministry of Health, that is the payer, the run of the show, the regulator of the whole thing. Transitionally, we have moved into forming healthcare clusters, and then organize in such a manner to really achieve their objectives. In the end state, these healthcare clusters that is composed of several hospitals and health centers that is distributed geographically across the country, and will have to run and focus more into providing the services into the journey there, where we can convert them into accountable care organization, or in some countries they call it integrated care organizations. So again, by 2030, the system will have to be based on outcomes. No, it's not about how much services I'm delivering into healthcare and how much, for instance, knee replacement or hip replacement surgery that I do, but how many of those people that have done these surgeries were able to walk properly and happy about the results. So it's more of the satisfaction of the service, outcomes of the service, rather than the service, volume of the service that is being given. Now, this includes a lot of details around how is that funding model that is being happening with Ministry of Finance, Ministry of Health, the contractual agreements between the health holding companies and the affiliates that is represented by the clusters. Again, so the operating model and the business model is based on several discussions and the decisions that need to be considered to structure that system. The funding mechanism that is around the efficiency point of delivering these services. The population health management is one essential key factor into determining the form of this business model. The purchasing mechanism for the services between the funder and the provider of the services, and a lot more of discussions. Now let's look at from like 20,000 feet, how would that look like on the country? The company of the health holding company are there up and running. It is a legal entity, and it has around 21 health clusters that is geographically distributed, west, central, south, north, and eastern. And each one has its own number of facilities, hospitals, that is 50, 200, 300, 500 beds, and their own staff. It has its own board of directors and C-suites level and chief executive officer. So it's more of look like a private hospital, but it's not fully private. It's not privatization. It's more of a corporatization. So geographically, each area has a business unit, and that's kind of a virtual company that has a regional and geographical characteristics. So Eastern province, as you can see to the right, has 3 different clusters. All of these 3 different clusters are reporting to a business unit for reporting and management purposes. But each cluster has its own board of director. It has its own autonomy, financially and managerially. So this is a component of each healthcare clusters that has number of network hospital and medical facilities that is represented in that level. Now, again, another review of that we have those 5 regions represented by 21 health clusters, which mostly now, a lot of them has been already activated and they are up and running and, in reality. And they are distributed and named according to a geographical region by those conventions. So who are our key players in this? Basically, the regulator, the Ministry of Health, the payer, Center of National Health Insurance, and that will be purchasing the service and also to fund those facilities to go forward. And then we have the health holding company that is managing the whole transformational journey for the whole customers. But we do have some enablers that need to be in the show, and that's basically to go and digitalize the health, prepare the workforce for the new roles, and also to participate and partner with the private sectors for moving forward. Let's focus more now into financials, financially speaking transformation, and I'll show you a quickly example of one of those clusters that I belong to, which is the third health clusters. So it's a journey in general, as you probably know, is moving from one state to another to describe strategically initiatives aiming to improve that state and enhance the governance and changing the tasks to either fulfill and achieve those objectives that is intended by the boards and by the key decision makers, either by probably shortening the budgeting time or focusing more into enhancing the software and application to better streamline these processes, or even, and I think more importantly, is to increase the efficiency on the spending and maximize the value out of the spending that is happening from the delivering the service. So going into lower level, now we have R3 third health clusters in Saudi Arabia, in Riyadh region. It is one of the 3 other clusters, and it is composed of a specialized hospital and another 13 hospitals, of totally aggregating to around 1,300 beds, and around 155 primary health centers. Now, we are covering a catchment area population of around 1.4 million, and the farthest hospital from the headquarters is around 600 kilometers. So we are distributed in a very mass, remote, geographically area. And average coverage of the primary health catchment area is around 9,000. So those are the number and names of the hospitals that we have under the jurisdiction of this healthcare clusters. And other health clusters are covering the other areas geographically around the kingdom on the central region. Let's look at our journey financially. Now, it's a path and a road show that we need to do. Starting from day one, we had that terminology day one where we have launched these clusters legally by the Ministry of Health, and where the board has been formed, the chief executive officer has been selected, and the suites, and we start functioning and thinking more of corporatized manner. So the day one is to move those roles smoothly from the current system, regional health cluster directorates, to the new operating and business model of the cluster, and that has happened back in 2021. Now, the next stage that has happened 2022, last year, is that we are having that patient level basic component infrastructures done. We need to have a better costing structure to monitor the cost incurred on the patient level. That has had to have its own setup and regimes and systems. We need to cater for revenue cycle management to deliver the service to non-eligible, and then probably that is another additional income arm. And other things to go corporatize and in a manner like clear out what are the assets that is owned by us. There is a clear, decent asset registers There are better accruals accounting financially that is based on IPSAS, the International Public Standards for non-for-profit organizations. And then probably now is to have how to figure out and set up the split of the budget from the big bulk budgets to those clusters. This year we need to do furthermore to reach our targets and have more autonomy and independence on the components budget. We need to cater for our performance indicators, going for more further advanced subjects like activity-based costing, completing the asset registers to strengthen the position of the corporate, and then in another couple years where we have more autonomy and readiness to move forward and manage the show with a better accountability and oversight by having those components agreed. How do this financial operating model look like from on the healthcare clusters? Now, as we said, we are corporatized, so we have to be looked at by a management at a higher level corporately, and board of directors. Chief executive officer has to oversee the activities operationally down the field. On the financial perspective, a finance vice president or chief financial officer needs to go and establish number of tasks to manage the operation, and on the same time we have to look for establishing the transformational components to transform and make sure that we are running the show. So looking around the financial day-to-day bookkeeping activities and the treasury and archiving and payments and billing, etc., and the journal entries, moving into the budget and how to plan for that budget and establish the better corporatized planning tools to also cater for the revenues coming to the health cluster. Moving into making sure that our spending is on an efficiency manner, operationally or on the capital side. Also to make sure that we are transforming at the same time. So it's more of a hybrid model where we manage the operation and at the same time we manage for transformation. So I focus more into spending efficiency. One of the key factors to transform and corporatize the entities is that there were a huge drastic increase in the healthcare spending expenditures all over the world, in particular in the country. And that sharp increase needs to be managed because the services and outcomes out of that increase really do not satisfy or have the right outcomes or the right value out of that justifies that high increase. So we need to watch our services. We need to maximize the outcomes and value of what we have spent by looking and doing a surgical interventions at the transactional level and make sure efficiencies and streamline and elimination of the waste as mechanism are there. These are the examples of some of the initiatives that are looked at as cost avoidance or savings that can be utilized somewhere else, and collectively it will impact positively the overall spending of the whole spending. Now we have number of spending, number of initiatives that is catering for around 140 million, as you can see here, that can have separate savings and cost avoidance to move into delivering the service. So introducing that concept is very essential, and it really has a positive impact on the way going forward. This takes me to probably the end of this slides, and I'm happy to have you any kind of questions around the subject. Yes, please.
Thank you very much. Just I would like to know what is the final impact to the end user, to the public, in terms of this transformation, financially and also in terms of service?
Great. Now, the key objective is that the patient and citizens receives the right service. The ultimate, very generic objective is that they have easy access to the healthcare services. The services will be granted for the citizens for free as they are eligible. They are not going to be insured and pay money or insurance policies to do this as of other regimes around the world. Also, they are focusing onto quality of the services rather than people doing a surgery for a need and then walking out without that total satisfaction. We are moving into the value-based, the outcomes-based. If you made knees replacement surgery, like I would be at a point of time saying I have successfully on the operation room done 100 of knee replacement surgery. But we're looking at over the outcomes. People needs to be compensated on the satisfaction of the service. How many of those 100 people were able, after they discharge from the hospitals, to be walking properly and do their day-to-day life as they expect? So it's more about the quality, around the access, the quick access to the service, the eligibility, and also to maximize the billions that we've spent on this sector, need to get the most optimum level of value out of it, and also to control that drastic increase on this expenditures that has drastically increased for the last 20 years in the country. I hope this answers some of the... Any further questions, guys? Thank you very much for listening. I hope that went smooth and short and sweet. Thank you very much.